Hello, my name is Inês Nunes da Cunha and I am the FIP Practice Development and Transformation Manager. Welcome to this CPD Bite focus on uncontrolled hypertension and the role pharmacists can play in improving patient outcomes. In this session, we will also introduce a new practical toolkit designed to support pharmacists in managing uncontrolled hypertension effectively. Before we dive into the main content, let's take a moment to go through the learning objectives of this video. By the end of the session, you will be able to describe the burden and complications of uncontrolled hypertension, identify its main causes, and understand the crucial role pharmacists can play in improving control. You will also become familiar with the new FIP publication supporting patients with uncontrolled hypertension, a toolkit for pharmacists, which provides practical resources to guide your practice. In this video, we will begin by exploring what uncontrolled hypertension is and its global impact. We will then examine its causes and complications before highlighting the important role that pharmacists can play in supporting hypertension control. Finally, we will introduce a new toolkit designed to help pharmacists manage uncontrolled hypertension in practice. According to the 2025 American Heart Association and American College of Cardiology guidelines, uncontrolled hypertension refers to blood pressure that remains above the target level, typically 130 over 80 millimeters of mercury or higher, even when a patient adheres to prescribed medication and follows recommended lifestyle changes. This ongoing elevation in blood pressure can silently damage vital organs, including the heart, brain, kidneys, and blood vessels, leading to severe complications such as heart attack, stroke, and kidney failure. Hypertension is one of the world's most common and serious health conditions. The World Health Organization reports that more than 1.4 billion adults live with hypertension, yet fewer than 1 in 5 have their blood pressure adequately controlled. High systolic blood pressure contributes to over 10 million deaths each year, many of which are preventable through early detection, effective treatment, and better follow-up. The burden is particularly high in low and middle income countries where limited access to care makes blood pressure control especially challenging. Globally, changing lifestyles and rising rates of obesity and diabetes further exacerbate the problem. Improving hypertension care, particularly for patients with uncontrolled hypertension, not only save lives but also strengthens primary healthcare systems and support healthier communities. Uncontrolled hypertension can arise from several reasons. In some cases, it reflects untreated hypertension or treatment plans that are not effectively reducing blood pressure. Secondary causes, such as other health conditions or the use of certain medications, may also contribute. Lifestyle factors play a major role, including tobacco use, obesity, excessive salt or alcohol intake, and lack of physical activity. Poor adherence to prescribed treatment is another important cause. Additionally, some people appear to have uncontrolled hypertension simply because their blood pressure measurements are inaccurate or affected by white coat hypertension. Finally, genetic factors and other multifactorial influence often interact with these causes, making hypertension control particularly challenging in some patients. Persistent uncontrolled hypertension can silently damage multiple organ systems. In the cardiovascular system, it may lead to angina, myocardial infarction, heart failure, and arrhythmias. Cerebrovascular complications include, for example, stroke. The kidneys can be affected, potentially resulting in chronic kidney disease or kidney failure. Importantly, uncontrolled hypertension is also linked to dementia and cognitive decline, highlighting its broad impact behind the heart. These serious complications emphasize why identifying and managing patients with uncontrolled blood pressure is critical and why pharmacists have such a key role in supporting effective hypertension control. Pharmacists can play a crucial role in improving hypertension control at community and primary care level. They can carry out regular blood pressure monitoring and help identify patients with uncontrolled hypertension early. Education patients about the silent nature of hypertension, the importance of ongoing control, and when to seek medical attention is essential for empowering individuals to take charge of their health. Pharmacists also support adherence to both medication and lifestyle changes, which it is key for improving outcomes. Pharmacists can promote regular self-monitoring and guide patients on how to measure their blood pressure correctly, which helps detect issues earlier and supports treatment adjustments. When necessary, pharmacists refer patients back to their doctor for further evaluation, helping to prevent serious complications. By actively supporting education, adherence, and monitoring, pharmacists empowering patients to manage hypertension effectively and reduce the risk of serious complications. To support pharmacists in managing uncontrolled hypertension, FIP has developed the Supporting Patients with Uncontrolled Hypertension, a toolkit for pharmacists. The toolkit provides practical step-by-step guidance to identify patients, provides tailored counseling, and support effective management, all while integrating smoothly into daily pharmacy workflows. You can access this new toolkit via the FIP NCD's webpage. Simply go to the main NCD's areas, select cardiovascular diseases, and then click on the Uncontrolled Hypertension tab. Supporting Patients with Uncontrolled Hypertension, a toolkit for pharmacists, has been developed to support community pharmacy teams in identifying and managing patients whose blood pressure remains uncontrolled. It aims to enhance pharmacists' role in providing motivational counseling and empowering patients to achieve and maintain optimal blood pressure through timely interventions and ongoing support. This research encourages a standardized approach to care, integrates blood pressure monitoring and management into the pharmacy workflow, and fosters collaboration with prescribers to optimize treatment outcomes. The toolkit is structured around 4 core elements, as you can see on this slide: an educational guide for pharmacy teams, an assessment tool to identify and track patients, a patient information leaflet, and a primary care referral letter to facilitate appropriate follow-up. The first document is the educational guide. The educational guide is designed to support pharmacists and pharmacy teams in providing care for patients with uncontrolled hypertension. It provides essential knowledge and practical guidance to help teams identify and monitor patients, deliver effective interventions, optimize treatment adherence, and improve blood pressure outcomes. The guide covers a comprehensive range of topics, including learning objectives, pharmacists' role in care, understanding uncontrolled hypertension, screening, assessment, and management. We recommend that all pharmacy staff involved in the program complete this self-study module to ensure they are fully equipped to deliver effective hypertension care, support patients in achieving optimal outcomes, and help them maintaining blood pressure control. The assessment tool is a conversation-based resource for pharmacists to support patient counseling, ongoing monitoring, and management of uncontrolled hypertension. It helps patients achieve better blood pressure control by structuring discussions around blood pressure, monitoring, adherence to medication, and lifestyle habits. The tool also provides practical advice for self-care, correct blood pressure measurement, and guidance on when to refer patients to primary care. This tool is designed to fit into everyday pharmacy workflow. The assessment takes around 10 minutes per patient and should be conducted in a private and comfortable space, reinforcing the pharmacist's role in education, adherence, and timely intervention. The Let's Talk About Uncontrolled Hypertension leaflet is a patient handout designed to summarize the pharmacist patient consultation and reinforce key messages about blood pressure management. It provides clear, practical guidance for individuals whose blood pressure remains above target despite treatment. The leaflet explains what uncontrolled hypertension is, why blood pressure can remain high even with medication, and highlights the importance of regular monitoring and symptom reporting. It also offers practical lifestyle tips, advice on improving medication adherence, and guidance on when to seek further supporting from the pharmacist or doctor. Pharmacists or pharmacy team members should complete and share the leaflet during or after the patient assessment. It takes less than 3 minutes to print and should be provided in a private supportive consultation setting. This tool helps patients retain key advice, stay motivated, and take an active role in controlling their blood pressure. On this slide, you can see examples of brochures including in the patient leaflet, such as lifestyle modification advice, my hypertension treatment plan, how to measure blood pressure, and the blood pressure monitoring record. The primary care referral letter for uncontrolled hypertension is a practical communication tool that allows pharmacists to collaborate effectively with patients, primary care physicians. It provides a clear summary of the reason for referral, such as persistently high blood pressure readings or reported symptoms, and includes key information like recent measurements, counseling provided, and any educational resources shared with the patient. The letter also includes a checklist for recommended follow-up actions by the prescriber, helping to ensure continuity of care and timely medical review. Pharmacists should personalize the letter with their details and those of the patients before sending it to the doctor. It can be printed or sent electronically and typically takes less than 5 minutes to complete. This tool strengthens collaboration between pharmacists and prescribers, ensuring that patients with uncontrolled hypertension receive the comprehensive care they need to achieve better blood pressure control. An infographic was also created to support the toolkit. It offers a quick visual guide on how and when to use the toolkit in practice, with direct links to its main resources to help pharmacists manage uncontrolled hypertension more effectively. In conclusion, uncontrolled hypertension remains one of the greatest challenges in global health, contributing to millions of preventable complications and deaths each year. Pharmacists, as accessible primary healthcare providers, are uniquely positioned to support patients whose blood pressure remains uncontrolled. Through regular monitoring, target education, adherence support, and follow-up, pharmacy teams can make a real difference in achieving and maintaining blood pressure control. The new toolkit provides practical guidance to help pharmacists deliver structured, impactful interventions, ultimately reducing complications and supporting healthier communities. To support pharmacists further in cardiovascular care, FIP publications include Cardiovascular Diseases Handbook for Pharmacists and the Cardiovascular Diseases Knowledge and Skills Guides. These resources outline the knowledge and skills needed to deliver effective services and complement this new toolkit, and both publications are available on the NCD's webpage. I hope you find these resources useful in your practice, and thank you for taking the time to watch this video.